Welcome everyone to this, the first of our three interactive educational sessions today, all of which address the very important topic of caregiving. Thanks so much for joining with us. We're especially grateful to the professionals who've kindly accepted our invitations to lead these discussions and honored that they'd be willing to do this. As these sessions are intended to be interactive, and especially those today, we encourage you to go ahead and ask questions. And the best way to do that is to perform the raise hand function in the Zoom platform. And Charles will acknowledge the raised hand and let you know that you'll be unmuted. And you can verbally ask the question, but you may also use the chat function for the Q&A, and also the Q&A function to type out the question for us, to ask it for you if you feel more comfortable doing that. So first up today is the Department of Veterans Affairs Visual Impairment Services Team Coordinator from Boise, Idaho, Mr. Travis Wilson. He's addressing the topic, what happens when the caregiver needs a caregiver? And Travis is actually an Army veteran. He served as an infantryman with the 82nd Airborne Division from 1991 to 1995. He graduated from Boise State University with a Master of Arts in Counseling in 2002. He's been working at the Boise VA Medical Center since 2007 and was hired as the VIST coordinator there in March of 2019 when Val Duffy retired. He volunteers with Project Healing Waters to help disabled veterans learn how to fish. So we'll turn the time over to Travis. Thank you for being with us.
Oh, you bet. Thank you very much. It's definitely my honor to be here to be able to present this topic. This is I kind of look at this as a little bit of an experiment as well. If there could be technical difficulties, so just asking for a little bit of patience just in case. And please feel free to ask questions as we go. Normally in presentations, that's kind of how it's been for me. I just really enjoy the interactive type of presentations. So yeah, once again, I'm honored to be here. So I'm going to attempt to share my screen again here, which I don't know I just did. So hold on here. Oh boy. There we go. I think I got it. Do I got it?
Yes, it's coming up, but I see the panels on the side.
Oh, darn it. Okay, let's see.
Use to select the start slideshow.
Oh, I thought Huh. I'm trying to remember what we did yesterday
on the bottom.
Down here.
Yes.
Okay, I clicked on that. Let's see. Did that change it?
No.
Okay, just one more second and then we'll get going. So I click down here. Well, I know. We're just gonna have to keep on moving. I think just gonna have to bear with me on that. For some reason, I know we had it yesterday, but it doesn't seem to be working today. So anyway, I want to start off with talking about about this topic. So this presentation does provide information that focuses on resources at the national level, but yeah, caregivers that are not veterans will have to understand that this will also vary from state to state. When we're talking about caregiver services for veterans, we have all these different programs established that are pretty much uniform across the nation. But as for a caregiver, if you're not a veteran, then it's going to take some research in your local area to figure out what it is that is provided and what you're eligible for in those areas too. So if anybody does have any questions, please feel free to ask, and we'll do our best. So what does caregiving look like? There are a variety of different programs out there, and some of these, they offer at state levels too. And of course, coming from Idaho, there are some similar programs that are offered as well. We start off with like home-based primary care. And what you're seeing here is really full medical and some mental health services provided to the patient, where the patient isn't homebound, where they can actually leave, but there is they do have a difficulty of the transportation piece of getting to those services. And right now with what's happening with COVID, leaving the house and everything like that is also adding an additional stressor, for everybody. And when you look at home hospice care, what you're looking at is for someone that is more homebound, not able to be able to get out and about as they used to. Homemaker and home health aides, these are programs that are designed to help come in and help with maintaining the home. Even can be bath aids for someone who does need help in taking a bath. I've worked with many veterans who have had this service where they also have someone coming in that sometimes help cook. So those are some aspects as you start thinking about caregiving services for the caregiver. What are these services going to be needed? An added benefit that I think that you're seeing at the VA and around the communities is the home telehealth. It's one of the things that's really been pushed during this pandemic is telehealth services. And I know throughout the local hospitals here, we're also seeing those services integrated into the homes, even if it's just through the telephone, or if you have capability of video chat, kind of like what we're doing right now. And as for like the visual impairment services programs, many of us are offering like telehealth support groups to be able to connect and reconnect with the veterans that we haven't been able to do those out in the community for some time. So they definitely have these other additional challenges, but with these challenges, we're learning how to adapt and overcome to be able to reconnect with our veterans and patients, and as well, is definitely a way of providing the services that are needed. Another aspect of caregiving services that can vary is respite care. So respite care is provided for the caregiver themselves. So it's someone coming into the home that helps the caregiver be able to step out, get away a little bit, maybe some self-care, take a break. That's needed, because that's one thing that with caregiving services and as caregivers, those who are in on this, presentation definitely can understand that being a caregiver full time can be very taxing, and it can be something that is can be overwhelming at times. So I definitely encourage anybody who is providing caregiver services, or when someone may want caregiver services, that they explore and see if this is something that they're eligible for as well. Skilled home care. This is also something that's a little more intensive for a patient that's homebound. They definitely will, come in and provide, similar services to what you get with the home-based primary care. You even have, even with these care, these services, some of the things that you're finding that take place is, through the visual impairment program, of course, our blind rehab specialists are visiting the homes, being able to go in and do that. You know, even here in Boise, our blind rehab specialist, she's modified her procedures so she can visit, you know, go to the homes and visit with all, you know, with safety and even, you know, COVID prevention and those kind of things, as well as, you know, all the staff that are doing these services. Some other services that you might see, you know, integrated within all these is, of course, like occupational therapy, rec therapy, physical therapy, you know, and mental health services, which is next, of course. With caregiving services, both the patient and the caregiver, you know, I think it's very important that we address mental health, you know, and what you need, and those services that are, let me back up, what you need and how to access that, how to access the, you know, the mental health providers here at the VA, because even, you know, they can go do the telehealth and they can talk to both of you and help address some of those things too. Transportation services can be a challenge as our population gets older. You know, sometimes, you know, like the caregiver gets to a point to where they can't drive. So how are they going to provide transportation to some important appointments that are needed? You know, how are they going to be able to provide transportation for food, or, you know, how are they going to be able to access food? Those type of things. So those things, you know, these just kind of a brief outline of what caregiving does look like. And like I said earlier, it can vary depending on where you live as well. Any questions so far? All right. So where does the caregiver begin? When they're looking at, you know, I would, one of the things I would definitely encourage is don't wait till the last minute. Don't wait until you come to a point to where you can't provide those caregiver services again. You know, start addressing it. Start addressing, you know, coming up with different plans that will benefit you when accessing caregiver services. And one of the first places to start is to discuss with your primary care provider. Talk to them about what's going on. You know, they can have recommendations. They can provide you with some more resources that you may need, that, you know, so you can get this process started.
Travis, we have a hand up.
Sure. Who do I have?
I don't have a name. I just have a number. And you can ask your question now, sir.
Hello, can you hear me?
I can.
Yeah, this is Gerard from Boston Regional Group.
Yes, hi.
Just want to know. I can't. You have an echo. I don't hear everything you're saying.
Oh,
But do you have anybody caregiver for a caregiver? Now, is there a contact number that's information somebody can inquire about this dilemma?
yes, there is, and I have resources further in the presentation. But what I'll tell you is some of the best resources that you can find would be your local VIST, your Visual Impairment Service Coordinator, and your local VA caregiver coordinator. You know, it is our job to have these resources accessible and be able to refer you to different, you know, different agencies to, you know, start researching some of this and start applying for some of these services. You know, there's also many different agencies out there that I'll show you when we get to the resources that you can access, that you can find them online, you know, and you know, follow through that way too. Does that help? Oh. All right. So the next thing, and you know, another important factor of you know, looking for your caregiver services, of course, is discuss with your family and or primary supports. it's something that hopefully, if there's someone in the family that will be able to provide the caregiver services, I think that would make things a little bit easier. You know, you can apply, and you know, sometimes you might be able to have someone from the community come in and become a caregiver. But if you have someone in your family or some close friend being able to do that, I it I think it keeps that level of trust going and support, and it'll be a better benefit. So, um, so essentially, is start the conversation now. Is, you know, I instead of waiting until the last minute. Keep track of important documents. Stay organized. Any medical records. As for veterans, of course, like your DD 214, that's always something that you need. And even your financial documents, making sure they are in order. Everything that you have, just stay organized. You know, maybe ask for some help with some of that too, with family and friends. That way, when it comes time to apply for these services, you do have everything that you do need. You don't have to go back and look for it or send off for it, you know, when the time comes. As mentioned earlier, you know, contact your local VIST or VA caregiver coordinator for community resources. That is a good place to start. It's, you know, it'll allow you to get, you know, to gain those resources and be able to start calling them. Contact your state Medicaid for services as well. See what's available within your state. I'd like to say that it would be uniform across the states, but it's not. It's all depending on funding. And, you know, but once again, it'd be good to be able to access those resources to find out what is, you know, available and what you're eligible for. Contact your local and national caregivers association and the commissions on aging. There are, you know, of course, there are definitely local commissions on aging that are, they have a plethora of information. And, you know, that's a great way to gather all that to be able to make your decisions. There's also a national, I want to say the National Council on Aging, which will, you know, it's essentially relatively the same. It provides you oversight and resources or to tell you what's happening in your state. Look at transportation services. You know, are there transportation services in the community? There, you know, here in Boise, we have several private community transportation services that do take the patients where they need. You know, the DAV, of course, does help for the veterans, but it's something that you want to make sure is set up. You know, even if you have a family caregiver, there might be times that they're not able to take you. You know, so it's just be able to have a plan of action for that, as well as food services. You know, what are you going to do to be able to, you know, maintain a good diet, maintain, you know, to be able to have food to eat. You know, where do you need to go for that? You know, is there a food pantry that your caregiver needs to take you to get? Do you need to access Meal on Wheels? You know, so just look into those services as well. Then also have definitely like home safety fall prevention plans. You know, when someone becomes a caregiver, it is pretty common for those, you know, the staff that help support the caregivers also, you know, come up with these different plans. Make sure this is what you do, you know, in case of a fall. So, you know, what do we do for emergency procedures? Do you have, you know, a guardian alert necklace? Those kind of things. Or, you know, just make sure that you're looking into that. And a lot of these services, again, are available through you know, the resources are available through the VIST and the caregiver coordinator, as well as outpatient social workers here. There's plenty of community-based services out there that mirror some of the ones that you see at the VA. And then at some point in time, you might want to research assisted living facilities or other caregiver resources. You know, I work with many veterans that, you know, their wives live with them at their assisted living facility. Or, you know, the spouse is also in the assisted living facility. You know, so those might be something to look at as well. if it comes to a time that, staying home probably isn't the best decision. So one thing I want to ensure here when we're talking about, this is definitely primary, this is for everybody, really, but when you're looking at a caregiver, you want to make sure that you are, staying healthy and you're taking care of yourself, and be able to access the respite care if you need that time for that self-care. But, these are things that are pretty normal, that are often said a lot, and sometimes we all struggle with them, and me included. So proper nutrition, making sure you have good nutritious meals, staying active, going for walks when you can, moving around the house. There's a variety of different things. Rec therapists definitely help out with some of that as well when they come visit through the home-based primary care. But if you don't have those services as a caregiver, that's something that I think would be a very big priority to put on your list of things to do daily, being able to move around a little bit more if you can. So, of course, personal hygiene, making sure you're taking care of yourself, you're bathing regularly, those kind of things, they all help someone feel better. It does help with your mental health as well. And then, of course, sleep. Sleep hygiene is definitely very important. It's definitely, I would say, personally for me, that's one thing I work on quite a bit. And getting that good night's sleep just makes wonders throughout the day. And sometimes, you might need to talk with your primary care provider and have a sleep study to help you sleep better. So that, these are definitely things that, I think is very important with taking care of yourself. Staying connected with family, friends, providers, anybody you can. It's very important. And even, especially during times like this with the COVID pandemic, being able to connect with others. When we started our virtual support groups, it was amazing to reconnect that way again. So it's been several months since we've been able to talk to everybody in a group setting. And even though it was virtual, it still was a very important aspect for that day. And I'm having more and more veterans come to me and wanting to become involved, and that way so they can stay connected. And then look at preventative health services. Once again, talk with your primary care provider. They're the ones, you want to be open and honest with them. They have a lot of pull and they have a lot of recommendations for you. That is very important. Talk with someone if you need to about your mental health. If you're feeling overwhelmed, if you're feeling depressed or anxious, or even if you're feeling suicidal, it's important to reach out or have someone reach out for you. Okay. Rehabilitation services, that's where I fall into place with the visual impairment, our bros, our OT, PT, rec therapy, just a variety of these rehabilitation services. Stay involved with your VIST. Stay involved with the caregiver coordinator, and build those relationships. We reach out all the time to to all of our veterans, and just to help maintain those relationships, and just stay connected with them. Telehealth, if possible. Telehealth is a great alternative right now than to doing the face-to-face with our primary care providers, or even our visual impairment service coordinators. And there's just a lot of services out there that provide this. And during the pandemic, this does help us, with a lot of our medical and mental health needs. And VA home health. So this is, in essence, a fairly new program that is being implemented. And it's about what matters to you. What do you want to work on with your health? And so that's a concept that's pretty, like you said, is new. And when we go see our primary care doctor, sometimes we're like, we just want to know, we want them to tell us what we want to work on. And sometimes that's not always the best, but if what matters to you and you express that, then you definitely are more apt to work on that. And, so that's the focus of the VA Whole Health. I'd like to see that expand more into our community providers. But, over time, we'll probably see something along those lines. Any questions yet? All right. So put in this slide because it is very important for you to advocate for yourself. Be able to talk with your providers, be able to talk with your family and friends on what you need, open and honestly. If sometimes that's a challenge, then, hopefully having someone there that can support you, your significant other, your spouse, you maybe one of your children, a close friend, someone to help you advocate for yourself. But this is very important for you to be able to get what you need, and if you're not hearing the right answers sometimes, keep advocating for yourself. That's just keep telling everybody what you do need. So recently, one thing that has come about, and it's with the Mission Act, and they're doing an amendment to the Mission Act, and it's comprehensive assistance for family caregivers, improvements and amendments under the VA Mission Act of 2018. So this right now is proposed legislation. One thing that was shared was, veterans previously eligible for a smaller VA SAH grant of $18,000 due to permanent blindness are now eligible for a larger grant at $90,000. So that's some proposed legislation that's going in it. But one of the main things that it's doing is it's coming out in two different phases. So the first phase is it's helping eligible veterans that have incurred or have a serious injury in the line of duty in the active military before May 7th of 1975. So what it's saying is this is providing eligibility for those veterans. And this will go into place as of October 1st of this year. The final phase, which will follow in 2 years, will expand the eligibility to veterans of all eras, regardless of when an eligible veteran's serious injury has occurred. So we're seeing these comprehensive services expand out. So it'll be nice for those veterans that served before May 7th, 1975, which does include World War II, Korea, Vietnam, to be able to apply for more caregiver services than what they were eligible for. So keep an eye out on this. As a VIST coordinator, I'll be watching it and sending out information to my local veterans. And so this is definitely something that, is something that's in law, or that's something that's being proposed to go into law. So anyway, yeah, like I said, keep an eye out for that one. So that brings us to some of our resources here. The question was asked earlier, where do we begin? Local VA support, caregiver support line is a very good support line. I apologize, that's a national number. But they will have your local caregiver support line contact information there if you need it. Contacting your local visual impairment service coordinator or your blind rehab specialist for that matter if they come visit you. National Suicide Hotline, please call this if you're having a rough time. That's what they're there for. They'll help guide you to more services if needed as well. There's also the Family Caregiver Alliance, and there's some numbers there for you. And these are national groups out there that definitely focus on our population that does need caregiving. National Alliance for Caregiving, of course, National Family Caregivers Association. I mentioned before the National Council on Aging. It's our Idaho Commission on Aging just has a plethora of resources for our veterans and as well as the general population to be able to access, so many more resources. So these resources are out there. It's just one thing I was hoping with this presentation is really to provide some emphasis on being able to research and plan for when you do need these services. And definitely encourage and empower those to do that. There's also a National Resource Directory, which has just a variety of different services, to include some with transportation and food. And then if you want more information on the VA Whole Health, there's a link here as well. If I'm not sure how I'm willing to share this presentation and for everybody to have it. I'm not quite sure what the logistics are on that yet, but we'll make sure that it gets out to everyone that wants it. Or if you do, want it, I can email it to you as well. And my email is there at the bottom. Have any questions?
We have a few questions.
Okay, good, because I think we're at that point.
Yes. Okay. We have a phone call. I'm going to allow you to speak now, sir. If you can unmute your, there you go.
Hello, can you hear me?
I can hear you.
Oh, very good. God bless you. Thank you for having this conference, and also because Gerard from Boston again. You mentioned a Caregivers Association. You have any contact information for them?
So the Family Caregiver Association, yes. Well, the Family Caregiver Alliance. I do have some phone numbers here, and I'll be glad to give them to you when you're ready. So the first phone number I have is area code 415-434-3388, or there's a 1-800 number as well. And it's 1-800-445-8106.
I noticed that Jerry Hogan had his hand up earlier. Jerry, do you still have a question you'd like to ask? Can you unmute Jerry? If he's still on.
Hello. Hi, Jerry.
Alta, Zoom weapon.
Can you hear me?
Audio now.
There you go.
Muted.
Now say I'm muted. I'm muted or unmuted?
You're unmuted, Jerry.
Okay, good. Let me do something here.
Space. Speech on demand.
How would I say that? Because you said a whole mouthful. I have transportation mode here, and I don't know if that would be that easy for other veterans to use the transportation mode. And I think it's real essential. And last year I was in the cardiology, and I was on a ventilator for 5 days, and they put me on the transportation mode, but I was trying to get into it back then anyway, and now they accept it as blind veteran. But we also have a VIST coordinator, which we used to have a VIST coordinator social worker. Their department moved him out of the VIST program, because he was never really qualified to be a VIST coordinator. And our grow person is no longer here, and he was gone since December. I mean, the first of the year, and he became a national consultant in Arizona in the blind program. But we have a VIST coordinator that does not have support. I know Idaho always been good, and a lot of the VA group been good in different area when it comes to sharing these type of information. But amazingly, me living here now in San Antonio, where I'm from Los Angeles originally, living here in San Antonio, Texas now, being a military town, USA, and there's a lot of veterans here. Even the disabled American veteran does not supply transportation for you unless you go a couple mile out of the valley. So it's not as easy, but trying to say a lot of things at one time in zebra, so excuse me the way I'm doing this. But then we also have a VIST coordinator that's active that really doesn't share the information, and unless the veteran know what's going on, the more she like it, because that's give us like, but for those of us that know what's going on, but those veterans that are new coming in, they don't know nothing, and they don't know it. In my situation, I plan my future ahead of time, not now, but what happened in a year or 2 or 3 years in my medical condition, because I don't want to move out of this house, and I want to stay here as long as I can. And I'm 69 now,
Mhm.
but my health condition has changed because that's just what it is. So that's all I have to say. But there's a lot I can say more, but I just kind of threw in a lot of things.
So Jerry, can you go ahead and ask, you have a specific question you can ask? We got a few other people that have questions.
Yeah, I'm kind of. We just don't. In order for me to know about the caregiver, I would have to count on my primary care position instead of the VIST coordinator, because the VIST coordinator does not even send out newsletter to let people know what's going on and what the veteran can and cannot do, and contact information. We never get nothing.
That would be a good place to start. There's also, outpatient social workers that can help out with some of that as well. So, but I would start with your primary care for some information, but then ask them to talk to an outpatient social worker as well.
That's what I do.
Good, good.
So
Thanks, Jerry.
Travis, we have a couple of questions in the Q&A. One of them is from Gerald Ryder, I believe,
Full
and
speed.
he's going back to when you were talking about how often when the caretaker can come to the home. He's asking who and how is it determined how often and how many hours the caretaker can come.
Okay, so the best person part of that depends on your eligibility for the caregiving and how much they offer. So when a consult goes to our caregiver coordinator, they look at everything. They look at what the need is, what is available, what supports you have in the community, and those kind of things. And then they will staff it with the veteran or the patient, and determine what is needed within the home. And then after that plan is designed and developed, it is forwarded to what we have here is we have a physician that signs off on these plans to get definitely get the medical seal of approval. And so that's kind of how it's determined overall. Does that answer your question?
I think
so.
we may have put him back on mute. Sorry about that. So we do have another question. It's from William Mathis. He says, my VA says that blind people do not need a caregiver. How do we work around that, given that my helper has to drive me all around and can't hold a job because of my appointments?
Well, this is where I think advocating for yourself would be very important. I don't think blindness is something that would not make you eligible. In fact, I think it make you more eligible. And we haven't ran into that problem here in Boise. And so that's why I'm kind of baffled by that. I would definitely address that, and there's always patient advocates at your local hospital that you can talk to as well. And so definitely advocate for yourself. Go to the patient advocates, talk with your primary care provider, and of course apply for it. the caregiver services continuously. That would be my recommendation.
There's a few more questions
Sure.
with their hands up. 978, you can ask your question.
Yeah, can you hear me?
I can.
Yeah, all right. Sorry about that. I didn't have my note taker wasn't working. Can
Oh,
you give me that number again for the Family Caregiver Association, please?
I certainly can. So we'll start off with the 1-800 number. 1-800-445-4445.
445? Right.
8106.
8106.
And another
Can I
number
repeat
that's,
it?
what's that?
I'm going to try and repeat that.
Okay.
Uh, 445. That's 8106.
Correct.
8106.
Very well done.
Thank you very much.
You
And
betcha.
thank you for having this conference.
It's my pleasure.
Okay, next we have veteran. You can unmute.
Hello.
Hello,
Hi, how are you?
Lord Everett over in Georgia. On the caregivers program, you was talking earlier about when the caregiver needs care, who provides funding for that? Say if somebody want to leave for a weekend and go to some place where they can rest and retreat. Is that a program that pays for that?
The respite care is a program that can be provided through your local VA. It's something you would talk with your caregiver coordinator about. So what happens is with respite care, there are different agencies out in the community that the VA does contract with. And so they set up a plan for that and essentially contract with this community agency with so many hours that, they provide a week for someone to come in and provide that respite care. So that's something I would talk with your caregiver coordinator about. It could also be an outpatient social worker that coordinates that too, but the caregiver coordinator would be a good place to start.
And
So I think we have time for one more question, and I think there's one more hand up. Charles, do you want to take that one?
Okay, Jim Vale. If you can unmute.
I think he needs to try to unmute one more time. There you go.
Can you hear me?
Hi, Jim.
Hi. Okay, so in response to the previous question of not being able to get services locally, you can go to the patient advocate and you can ask to file a clinical appeal.
Yep.
And there's a VHA instruction on that. If you need help, call our office, call the BVA headquarters, and ask to speak to Jim Vale, and I can walk you through it.
Thanks, Jim.
But a lot of times they'll say, "Oh, you can't get that. You're not eligible for that." Well, have them put it in writing. And if I have to, I can go to VACO and have central office get involved. But first, you have to go through your patient advocate, because VACO is going to ask me, did they talk to the patient advocate? Who did they talk to? And I need names, dates, and times to help advocate for you.
Yeah. Awesome. Thanks, Jim. Appreciate that.
No problem.
So if anybody does have any more questions or comments, feel free to email me. It's been a pleasure and an adventure. Definitely something new for me to do. And I appreciate each and every one of you.
Thank you very much, Travis. This has been really informative and great. We really appreciate the time you took to prepare and to come and do this with us. It's a new thing for us also. We actually could see your screen just fine. And we just couldn't see, the full screen.
Yeah.
But please, please come back and do this again with us. It was fun, and it was great to have you, and had some good questions as well. So
Absolutely. I'll be glad to do it in the future.
absolutely. Hopefully we can have a great rest of the day.